This is a quick review from class on obstructive pulmonary diseases. For an asthma patient, when receiving albuterol, the wheezing may be louder and increase. Anytime there is a use of accessory muscles, the patient may be in respiratory distress. A change of meds is needed if they have seasonal times when symptoms are worse, and leukotriene modifiers could be used in some patients with asthma. An example of a leukotriene modifier is Singulair. Beta blockers such as propranolol can cause bronchospasm in some patients with asthma. IV corticosteroids would require several hours before having an effect on respiratory status. Therefore, inhaled corticosteroids might be more effective in improving asthma and indicated for patients with persistent asthma. Zoloft can cause flushing and dizziness and may indicate that the patient is experiencing an anaphylactic reaction and an immediate intervention is needed. Other meds will be discussed in the skills lab. COPD is a chronic inflammatory lung disease that causes obstructed airflow from the lungs. An anterior-posterior chest ratio for a 1:1. Pursed lip breathing techniques are used to assist in prolonging the expiratory phase of respiration and decrease air trapping. Lung expansion decreases bilaterally. Hyperresonance to percussion. Chest expansion is reduced. The patient can receive medications such as bronchodilators, inhaled steroids, combination inhalers such as Advair and Symbicort, oral steroids, phosphodiesterase 4 inhibitors like roflumilast, and that decreases inflammation and relaxes the airways, theophylline, antibiotics, and oxygen therapy. Now keep in mind a meta-interaction that cimetidine interferes with the metabolism of theophylline, and if cimetidine is given with theophylline, it could rapidly lead to theophylline toxicity. Eating small amounts more frequently also occurs with snacking will increase caloric intake by decreasing the fatigue and feelings of fullness associated with large meals. Patients with COPD should rest before meals. When COPD occurs in young patients, especially without a smoking history, a genetic deficiency called an alpha-1 antitrypsin should be suspected. Hypoxia interferes with the patient's ability to learn and retain information, so it's important to have a patient's caregiver present, and it will increase the likelihood that discharge instructions will be followed. An oxygen saturation of 90% indicates adequate blood oxygen levels without the danger of suppressing the respiratory drive. The use of home oxygen does improve quality of life and prognosis. The patient's perceived dyspnea level could also be affected by other things, such as anxiety. An increase in respiratory rate could indicate respiratory distress, and that would need for a rapid intervention from the nurse, assessment, administration of oxygen or medication. Cystic fibrosis. In cystic fibrosis, the airways fill with thick, sticky mucus, making it difficult to breathe. The thick mucus is also an ideal breeding ground for bacterial and fungi. A sweat test is a sweat-producing chemical is applied to the small area of skin. The collected sweat is then tested to see if it's saltier than normal. Genetic testing. DNA samples from the blood can be checked for specific defects on the gene responsible for cystic fibrosis. There is no cure for cystic fibrosis, but treatment can ease symptoms and reduce complications. Antibiotics are used to treat and prevent lung infection. Mucus-thinning drugs to help cough up the mucus, which improves lung function. Bronchodilators to help keep the airway open by relaxing the muscles around the bronchial tubes. Oral pancreatic enzymes to help the digestive tract absorb nutrients. Patients with cystic fibrosis need a high-calorie diet. Increased glucose levels may indicate the patient may be developing cystic fibrosis-related diabetes, and insulin therapy may be required. Because the etiology of diabetes and cystic fibrosis is inadequate insulin production, oral hypoglycemic agents may not be effective. Resting in bed with the head elevated in a semi-Fowler's position will be an alternative position if the patient is confined to bed, but sitting in a chair would provide better ventilation. Bronchiectasis. This is a condition in which the lung airways are abnormally stretched and widened, and this stretching and widening is caused by mucus blockage. More and more mucus builds up in the airways, allowing bacteria to grow, and this can lead to infection. Bronchiectasis can develop at any age, and a patient may complain of sharp pain. It is also caused by blockage in the airway due to growth or something inhaled, like a child that would inhale a piece of a toy or a peanut. With proper treatment, most people with bronchiectasis can live a normal life. Scattered bronchi and wheezes are expectations. Hemoptysis, however, may indicate life-threatening hemorrhage and should be reported immediately to the healthcare provider.